Hello, future comadrons. Welcome to the world of midwifery. Again, I am teacher Cecil, and welcome to this video lecture as I share my knowledge and experience to guide you every step of the way of your journey of becoming a midwife. So, let's learn together and make a difference in the world. Before I formally start with the discussion, I would just like to present a disclaimer. This PowerPoint presentation is intended for educational purposes only. It contains information, images, or other media that have sourced from various authors, publications, websites, or other sources. Therefore, I acknowledge and give full credit to the original author and/or owners of the information, images, and media used in this presentation. Furthermore, I recommend conducting further reading from other sources for information presented to deepen your understanding of the topic presented. Welcome to today's lecture on the fascinating topic of physiologic adaptations of mother to pregnancy. Pregnancy is a remarkable and complex process during which a woman's body undergoes numerous physiological adaptations to accommodate the growing fetus and support its development. These adaptations are orchestrated by a delicate interplay of the hormonal, cardiovascular, respiratory, musculoskeletal, and immune system changes. All are working together to ensure the health and well-being of both the mother and her unborn child. The first organ system for us to explore its crucial role during this remarkable period will be the reproductive system. The reproductive system plays a central and vital role in pregnancy, as it is responsible for conception, nurturing the developing fetus, and eventually bringing forth new life into the world. Understanding the importance of the reproductive system during pregnancy is vital for midwives, as it allows us to monitor and assess the well-being of both the mother and the developing fetus, and ensure a safe and healthy pregnancy experience for the expectant mother. The uterus, a remarkable muscular organ, undergoes several significant changes to accommodate the growing fetus and prepare for childbirth. Firstly, let us explore the changes in blood flow. Before pregnancy, the uterus receives approximately 20 ml of blood per minute. However, as pregnancy progresses, the demand for oxygen and nutrient increases, leading to a remarkable increase in uterine blood flow. By the end of pregnancy, blood flow to the uterus reaches a staggering 700 to 900 ml per minute. This substantial increase in blood flow is vital for providing an adequate oxygen and nutrient supply for support of the developing fetus. Next, let's consider the change in shape. Prior to pregnancy, the uterus is pear-shaped. However, as pregnancy advances, the uterus gradually transforms into a spherical shape and later takes an ovoid shape during the last month. This change in shape is necessary to accommodate the growing fetus and provide sufficient space for its development. The position of the uterus also undergoes a significant shift. Approximately 12 weeks of gestation, the uterus loses its anteflex position, where it is tilted forward. Instead, it gradually assumes a more vertical position within the pelvis. This change in position allows for optimal fetal growth and positioning within the womb. Furthermore, as a muscular organ, the uterus exhibits contractility throughout pregnancy. From the first trimester onward, the uterus experiences irregular contractions known as Braxton Hicks contractions. These contractions are relatively mild and serve as a preparatory mechanism for labor. As pregnancy nears term, these contractions become more intense and may be experienced as tightening sensations in the abdomen. Next, we shall also look into the changes in the location of the fundus, which is the upper part of the uterus, as pregnancy progresses. During the early stages of pregnancy, the fundus is typically within the pelvis, behind the symphysis pubis. This position is referred to as the retroverted or the retroflex position, where the fundus is tilted backward. As pregnancy advances, the fundus gradually rises out the pelvis and become more palpable above the pubic bone. By approximately 12 weeks gestation, the fundus reaches the level of the symphysis pubis. As the pregnancy continues, the fundus continues to rise and can be felt at different levels during different stages. By around 20 weeks gestation, the fundus reaches the level of the umbilicus. As the third trimester unfolds, the fundus continues to ascend. By 36 weeks, the fundus is typically located near the lower part of the sternum known as the xiphoid process. Finally, the last few weeks of pregnancy, the fundus may reach its highest point, extending up to the area just below the breast. The location of the fundus provides valuable information about gestational age and growth of the fetus. So by palpating and measuring the fundal height, a midwife can estimate gestational age, identify any potential growth abnormalities, and assess the position of the fetus within the uterus. Let us continue our exploration of the remarkable physiologic adaptations that occur on woman's body during pregnancy. This time, let us look on the changes that takes place on the cervix. One of the noticeable changes under the cervix is the alteration in color. Normally, the cervix appears pinkish in color. However, during pregnancy, it increases blood supply to the area, which causes the change in color, turning it into purplish hue. This change is often referred to as Chadwick's sign. This is an observable indicator of pregnancy and is attributed to the increased vascularity and blood flow to the cervix. Another change that occurs under cervix is an increase in mucus production known as leukorrhea. Leukorrhea refers to the thick, white, or yellowish discharge that is commonly experienced by pregnant women. This increased mucus production serves an important purpose. It leads to the formation of the operculum, known as the mucus plug, which seals the cervix. The operculum acts as a protective barrier, preventing the entry of bacteria into the uterus and reducing the risk for infection. As the term approaches, the cervix prepares for labor and the operculum may be discharged, which is known as show. The discharge of the operculum is considered as a significant sign of impending labor. Furthermore, another notable change under the cervix is the softening of the cervix, referred to as the Goodell's sign. This softening is observable as early as 6 to 8 weeks gestation, and it is attributed to increased vascularity and hormonal changes. Goodell sign is again another important clinical indicator for assessing the progress of pregnancy and the readiness of the cervix for labor. We will now explore the changes that occur under isthmus. One of the notable change under the isthmus is the occurrence of the Hagar sign. Hagar sign refers to the softening of the lower uterine segment, which can be observed during early pregnancy, starting as early as 5 weeks. This softening of the lower uterine segment is a result of a hormonal change and increase in blood flow to the area. Hager sign is a valuable clinical indicator for healthcare providers, including midwives, as it provides important information about the progress of the pregnancy and the readiness of the cervix for labor. We will also explore the physiologic adaptations of the mother to pregnancy on the changes that occur within the vagina. One of the notable changes within the vagina is the occurrence of the Chadwick sign. Chadwick sign refers to the change in color of the vaginal tissues. Normally, the vagina is pinkish in color. However, during pregnancy, the increased blood supply to the area causes a change in color, turning it to a purplish or dark bluish hue. This change in color is a result in increased vascularity and is considered a notable indicator of pregnancy. Another significant change within the vagina is the softening of the vaginal tissue. This softening is an important adaptation that allows for easier distension during labor. The vaginal tissues become more elastic and pliable, preparing the birth canal to accommodate the passage of the baby during childbirth. Next, let us also explore on the physiologic adaptations that occur within the ovaries. During pregnancy, the ovaries undergo significant change to support the developing fetus. One of the notable change is the absence of Graafian follicle and the suspension of ovulation. Normally, the ovaries release a mature egg, egg in each month through the process of ovulation. However, during pregnancy, the development of Graafian follicle ceases and ovulation does not occur. This is an important adaptation that ensures the preservation of the growing fetus and the maintenance of pregnancy. Additionally, during early stages of pregnancy, the corpus luteum plays a crucial role in hormonal production. The corpus luteum is the structure that forms from ovarian follicle after ovulation. So it acts as the chief source of hormone progesterone during the first 12 weeks of gestation. This progesterone plays a vital role in maintaining the endometrium, supporting the implantation of the fertilized egg, and preparing the uterus for pregnancy. The corpus luteum ensures the adequate production of progesterone until the placenta takes over its production later in pregnancy. Moving on, let us also take a look on the changes that occur under the breast. One of the notable change under the breast is an increase in size. During pregnancy, the breast undergoes significant changes in preparation for lactation and breastfeeding. These changes include the growth of the alveolar tissues, increase in fat depositions, and heightened vascularity. These factors contribute to an increase in breast size as the breasts become fuller and more rounded. In addition to the increase in size, there are other changes associated with pregnancy that affects the breast. Many women experience a feeling of fullness and tingling sensation in the breast. This sensation is often attributed to an increase in blood flow and hormonal changes. Estrogen, occurring in preparation for breastfeeding. Another change is the darkening of the skin around the areola or the pigmented area around the nipple. This darkening is common occurrence during pregnancy and it is believed to be influenced by the hormonal change, specifically the estrogen and progesterone, which stimulate the production of melanin or the pigment that gives the skin its color. This can lead to darkening of the skin, particularly in the areas that are already prone to hyperpigmentation, such as the face, the neck, and chest. Additionally, the Montgomery glands, which are the small sebaceous glands on the areola, becomes more prominent during pregnancy. This gland secretes oil, that lubricates the nipple and provide protection. The nipple themselves may also undergo changes. They may become more pronounced and stand out more prominently. This change is attributed to the increase in blood flow and, again, hormonal changes. Furthermore, starting as early as fourth month of gestation, a clear liquid known as colostrum may be expressed from the breast. Colostrum is the first milk produced by the breast before the transition to mature milk. It is rich in antibodies and nutrients, providing essential support to the newborn's immune system. Moving on, let us also look into the changes that take place under the blood volume of the pregnant woman. One of the significant change during pregnancy is an increase in total blood volume. Throughout pregnancy, the total of blood volume increases by approximately 45 to 50%. This increase is attributed to various factors. First is on hormonal changes. The hormone estrogen and progesterone play a role in the increasing blood volume. Estrogen stimulates the production of red blood cells, while progesterone increases the retention of fluid. Another one is the increased fluid retention. The placenta produces hormone called the relaxin, which relaxes the wall of the blood vessels. This allows more fluid to leak into the bloodstream. Another factor is the demand of the developing fetus. The fetus needs a constant supply of oxygen and nutrients. The increased blood volume helps to ensure that these needs are met. The increase in blood volume, which is approximately 75%, is comprised of plasma, the fluid component of the blood, while the remaining 25% consists of the red blood cells. This alteration in blood composition is essential support to the need of the growing fetus and to ensure optimal oxygen and nutrient supply. The increase in blood volume occurs gradually, beginning towards the end of the first trimester, and it will reach its peak around 28 to 32 weeks gestation. This gradual rise in blood volume will allow the body to adapt to the changing demands of pregnancy and ensure the adequate supply of oxygen and nutrients to the developing fetus. Another is on the changes that takes place on the blood constituents. One of the significant changes in the blood constituents during pregnancy is it involves an increase in red blood cells, or the RBC, production by the bone marrow. The bone marrow ramps up its production of RBC by as much as 33%. This increase is necessary to compensate the rise in plasma levels and maintain the adequate oxygen carrying capacity. Additionally, the hemoglobin level increases to around 15%, further supporting oxygen delivery to the developing fetus. As a result of the increasing plasma level, hemodilution occurs, causing a phenomenon known as the pseudoanemia. Hemodilution refers to a decrease in the concentration of the RBC, or the red blood cells, in relation to plasma level. Although the actual number of RBC increases, the relative proportion of RBC decreases, leading to dilution effects. This pseudoanemia is a normal adaptation to ensure an optimal balance between blood volume and the ability to transport oxygen and nutrients. Another change in blood constituent during pregnancy involves the increased level of clotting factors. Pregnancy triggers the production of various clotting factors in the blood, making the woman more prone to thrombus formation. This adaptation is essential to prevent excessive bleeding during childbirth. However, it also increases the risk of blood clot formation, specifically in the lower extremities. So midwives play a crucial role in assessing and monitoring the risk for thrombus formation, implementing appropriate preventive measures, and of course, educating mothers about the signs and symptoms of thrombosis. One of the changes in the blood constituent during pregnancy includes another one is the slight elevation in the white blood cells or the WBC count. This increase is considered a protective mechanism of the body to prepare for potential infections and provide an enhanced immune response during pregnancy. The slight elevation in WBC count helps to safeguard the health of both the mother and the developing fetus. Additionally, the protein level of the blood decreases during pregnancy. The decreased protein level is a result of the utilization of proteins by the growing fetus for its own growth and development. This decrease in protein levels can contribute to normal dependent edema, primarily affecting the ankles and feet of the pregnant woman. It is important then for midwives to recognize and differentiate between normal dependent edema and the pathologic edema, such as in cases of preeclampsia. This is to ensure appropriate assessment and management. Another change in blood constituent during pregnancy involves an increase in lipid and cholesterol levels. Lipid and cholesterol serve as a readily available energy supply for the growing fetus. The increase in lipid and cholesterol levels up to 90 to 100% compared to pre-pregnant levels ensures that there is an adequate energy source for the developing fetus. These lipids and cholesterol are essential for the growth, the organ development, and of course, the overall metabolic processes. So understanding the changes occurring with blood constituent during pregnancy is of paramount importance for healthcare professionals, particularly midwives who are caring for the pregnant women. So here are our responsibilities as midwives to our clients. First, monitoring maternal health. So we should have the knowledge of the blood constituent changes so that we will be able to monitor the overall health of the pregnant woman. By assessing these parameters, we can be able to identify abnormalities or any signs of health concerns. And another one is for assessing the fetal well-being. This blood constituent provides an insights into the well-being of the developing fetus. A change in protein levels, lipid and cholesterol levels, and also for the clotting factor can indicate the nutritional status, the growth, and the metabolic processes of the fetus. Midwives can use this information to assess the fetal development and adjust the care plans accordingly. Another one is in identifying and managing complications. By understanding blood constituent changes, it will help midwives recognize and manage pregnancy-related complications. For example, knowledge of increased clotting factors and pseudoanemia will aid in the assessment for the risk of thrombus formation and identifying signs of pathologic edema. So as a midwife, we will be able to intervene promptly and provide appropriate care to mitigate potential complications. Next is to anticipate and respond to maternal adaptations. So awareness of blood constituent changes will enable a midwife to anticipate and respond to the physiological adaptations the mother's body undergoes during pregnancy. This knowledge helps them address common symptoms such as palpitations, dependent edema, immune system modifications. providing reassurance and appropriate care to pregnant women. Lastly, promoting holistic care. By considering blood constituent changes alongside the other physiologic adaptations, midwife will be able to provide holistic care to these pregnant women. Understanding the interplay between various systems and their impact on blood constituent will allow for comprehensive assessment and personalized interventions to optimize maternal and fetal well-being. Let us as well discuss the changes that takes place within the heart. During pregnancy, the heart is displaced. As the uterus grows in size, it pushes against the diaphragm, causing the heart to rise. This upward displacement of the diaphragm lead to the displacement of the heart to the left and upward within the chest cavity. These adaptations allow for optimal positioning of the heart to accommodate the expanding uterus and ensure efficient blood flow to both the mother and the developing fetus. As a result of this displacement, the heart and the physiological changes occurring in the cardiovascular system, a pregnant woman experiences palpitations. Palpitations are sensations of a rapid or irregular heartbeat. So during the first trimester, palpitations may occur due to increased parasympathetic stimulation, while later in pregnancy, the enlarged uterus can exert pressure on the heart, leading to palpitations. It is essential for midwives to assess and monitor palpitations to ensure that they are within normal limits and not indicative of an underlying cardiovascular condition. Additionally, pregnancy associated with an increase in pulse rate. The pulse rate of a pregnant woman typically increases by 10 to 15 beats per minute. This increase is considered a normal adaptation to meet the increased demands of the maternal body and the developing fetus. The elevated pulse rate helps to facilitate the delivery of oxygen and nutrients to both the mother and the baby. Next, let us also take a look on the changes that takes place in the woman's blood pressure. During pregnancy, the blood pressure generally remains at or slightly below the pre-pregnant levels. In some cases, there may be a slight drop in blood pressure during the second trimester, but it typically returns to normal level as pregnancy progresses. This maintenance of the blood pressure within normal range is important for the overall well-being of both the mother and the developing fetus. However, it is essential to be aware of a specific condition called supine hypotension syndrome, also known as the inferior vena cava syndrome. This syndrome occurs when the growing fetus compresses the inferior vena cava against the vertebrae, obstructing blood flow from the lower extremities. As a result, there is a decrease in blood return to the heart, leading to decrease in cardiac output and, of course, hypotension or yung tinatawag nating low blood pressure. The decrease in cardiac output and hypotension associated with this supine hypotension syndrome can have consequences for both the mother and the developing fetus. It can result in decreased placental perfusion, leading to inadequate oxygen and nutrient supply to the developing baby or fetus. This can potentially lead to fetal hypoxia or oxygen deprivation on the fetus. Therefore, it is crucial for pregnant women to avoid lying flat on their back for prolonged periods, especially in the later stages of pregnancy, to prevent decompression of the vena cava and minimize the risk for supine hypotension syndrome. So as a midwife, we have to educate our clients that they should decrease or avoid lying flat on their back for a long periods of time. Instead, we have to um, educate them that they have to lie on their left, or they have to assume a left side lying position. Additionally, during pregnancy, there is a decrease in amount of blood pressure returning, or there is a decreased amount of blood returning to the heart, which subsequently lead to decrease in cardiac output. This reduction in the cardiac output can result in certain manifestation for mother, including the decrease in blood pressure. The decrease in blood pressure experienced by pregnant women may lead to additional symptoms related to decreased blood supply going to the brain. These symptoms can include now dizziness, hilo, faintness, or kumbaga parang nawawalan na ng malay, and lightheadedness. So it is important for midwives to recognize and address these symptoms to ensure the well-being of the mother. In terms of the management, it is advisable to educate the mother, avoid prolonged periods of lying on her back, especially during later stages of pregnancy. Instead, she should be encouraged to adopt a left side lying position when resting or sleeping. This position helps prevent compression of the inferior vena cava by the growing uterus, allowing for better blood flow and reducing the risk of decreased cardiac output and associated symptoms. It is also as well important to know the increased iron needs during this transformative period. Iron play a vital role in the body, particularly during pregnancy, as it is essential for the production of the red blood cell and the transport of oxygen to both the mother and the developing fetus. So let's take a closer look at the changes associated with increased iron needs during pregnancy using this acronym, the IRON, IRON. I stands for the increased requirement for the fetus. So as the baby grows and develops, there is an increased demand for iron, approximately 350 to 400 milligrams throughout pregnancy. R highlights the increase in RBC mass. To support the growing blood volume and meet the oxygen carrying needs of the mother and fetus, an additional 400 milligrams of iron is required. The O emphasizes that meeting the increased iron during pregnancy and it offers protection against anemia. Anemia is characterized by the low level of hemoglobin and RBC, and can have a detrimental effect on both the mother's health and the developing fetus. Thereby, adequate iron intake helps prevent anemia and it will support optimal oxygenation. Lastly, the letter N reminds us that iron absorption during pregnancy is compromised due to decreased gastric acidity. This decrease in gastric acidity can limit the absorption of iron from dietary sources. As a result, it is important for pregnant women to consume iron-rich foods and consider iron supplement and to ensure the sufficient iron intake. Another one is also to um, consume vitamin C for better absorption of iron. So to meet the total iron needs during pregnancy, which is estimated to be around 800 milligram, a midwife play again a crucial role in educating and guiding expectant mothers about the importance of balanced diet rich in iron, and of course to take this iron supplement recommended to meet this demand. Let us now explore into the changes that occur in the respiratory system during this remarkable journey. The respiratory system undergoes several adaptations to meet the increased oxygen requirement of both the mother and her growing fetus. So, Let us explore the chief causes of these changes using the three key factors, which are increased oxygen requirement, effects of hormone, and mechanical impact of the enlarging uterus. Firstly, the growing fetus and the mother herself have an increased demand for oxygen. As the pregnancy progresses, the mother's body must supply oxygen not only for her own needs, but also for the developing fetus. This increased oxygen requirement triggers a series of changes in the respiratory system to facilitate adequate oxygenation. Secondly, hormones, progesterone and estrogen, play a significant role in the respiratory adaptations. Progesterone, which is a hormone that is produced in abundance during pregnancy, acts as a respiratory stimulant. Bakit? It will stimulate the respiratory center in the brain, resulting in an increase in respiratory rate. Estrogen, on the other hand, which is also high during pregnancy, will enhance the blood supply to the respiratory system, supporting the increased oxygen exchange. Lastly, the enlarging uterus exerts mechanical effects on the respiratory system. As the uterus expands to accommodate the growing fetus, it will occupy more space within the abdomen and it will push the upward on the diaphragm. This mechanical pressure will be reducing the space available for the lungs to fully expand, leading to a slight decrease in lung capacity and increase in respiratory effort. These changes collectively contribute to the adaptations of the respiratory system during pregnancy, again ensuring the sufficient oxygenation for both the mother and the developing fetus. Another notable change in the respiratory system is hyperventilation, which refers to an increased rate and depth of breathing experienced by mother. This is the body's way to compensate for the increased carbon dioxide production from the growing fetus. So by hyperventilating, the mother will blow off the extra carbon dioxide, helping to maintain normal level of carbon dioxide in her body, thus preventing respiratory acidosis. Additionally, the enlarging uterus exerts pressure on the diaphragm. It will be displacing it upward up to 4 centimeters. This displacement has several effects on the respiratory function. So first, it will lead to chest crowding, where the space available for the lungs to expand vertically is already reduced. To compensate for this, the mother will expand her lungs horizontally, allowing for a greater expansion for the chest wall during inspiration. Secondly, the displacement of the heart of the diaphragm rather decreases the residual volume, which is the amount of air that is left in the lungs after full expiration. So yung naiiwan sa ating lungs after po tayo mag-exhale. Okay? With a decrease in residual volume, less air remains in the lung, reducing their capacity to take in as much oxygen during each breath. These changes in the respiratory system can result in a sensation of shortness of breath or breathlessness in pregnant women. So it is important for us midwives to reassure expectant mothers that this is a normal adaptations to pregnancy and provide guidance on appropriate breathing technique so that to allow or to help them alleviate any discomforts. Additionally, another significant change in the respiratory system during pregnancy is the increase in tidal volume, which refers to the amount of air inspired during each breath o yung naipapasok po natin na air during inhalation. Tidal volume can increase by as much as 40% to meet the heightened oxygen requirements of both the mother and the growing fetus. This increase ensures an adequate supply of oxygen to support the metabolic needs for both the mother and the fetus. In addition to the increase in tidal volume, the total body consumption of oxygen will also rise by approximately 15 to 20% during pregnancy. This increase reflects the greater demand for oxygen by various organs and tissues as they support the growth and development of the fetus. Furthermore, it is common for pregnant women to experience nasal congestion or yung parang palaging may nakabara sa kanilang ilong. Okay, so this congestion is primarily caused by the stimulation of the estrogen. Okay, so si estrogen dahil mataas po ang level niya during pregnancy, siya po yung reason why there is a nasal congestion or common ang nasal congestion during pregnancy. The increase in the level of estrogen can lead to the swelling and congestion of the nasal mucosa, resulting to the feeling of stuffiness or nasal obstructions. So as midwife, it is our responsibility to be aware of these respiratory changes and their implications. So we should encourage pregnant women to practice deep breathing exercises, maintain good posture to optimize lung expansions, and also to ensure that adequate ventilation in their living environment will alleviate any discomfort caused by this nasal congestion. Moving on, let us also look into the changes in the urinary system. One of the notable change in the urinary system during pregnancy is the increase in urinary frequency o yung palagi po silang naiihi. This increase is experienced during different stages of pregnancy due to various factors. In the first trimester, as the uterus begins to rise out of the pelvic cavity, it will exert a pressure on the bladder, leading to a sense of urgency and more frequent trips to the bathroom. And the second trimester, after the lightening or yung pagbaba or the descent of the baby's presenting part into the pelvis, the pressure on the bladder increases and further contributes to the urinary frequency. Another significant change in the urinary system is the increase in blood flow to the kidneys. This increase in blood flow leads to the elevation in the glomerular filtration rate, which is the rate at which the kidneys filter waste products and excess fluids from the blood. Consequently, there is also an increase in urinary output as the kidneys work to eliminate these substances from the body. Additionally, it is also important to note that the presence of sugar or lactose in the urine, known as lactosuria, is considered normal during pregnancy. Okay, remember yung normal na sinasabi natin is just at a certain level. Okay, so this occurs due to changes in the glucose metabolism and hormonal influences. However, it is still important to monitor the blood sugar levels to ensure that they remain within the healthy ranges. Moreover, it is also in the urinary system during pregnancy that there is a notable increase in urinary output. This is necessary as the mothers need to excrete her own metabolic waste as well as those produced by the growing fetus. So the kidney plays a crucial role in filtering waste products and excess fluid from the blood, ensuring the elimination through the urine. In addition, the increase in urinary output, there are also significant changes in the renal functions during pregnancy. The GFR or the glomerular filtration rate, which measures the rate at which the kidneys will be filtering blood, can increase up to 40%. This elevated GFR and increase in renal plasma flow will contribute to the efficient removal of the waste product from both the mother and the developing fetus. Another change is in the concentration of the renin, the angiotensin 1 and 2, which are substances that are involved in the regulation of blood pressure and of fluid balance in the body. Their increase in concentration during pregnancy will help maintain appropriate blood pressure level and fluid homeostasis for both the mother and the developing fetus. Furthermore, it is also important to note that the kidney undergoes a slight increase in size during pregnancy. So, lumalaki po siya ng kaunti lang. This enlarges a natural adaptation to support the increase in the demands placed in the urinary system. One significant factor for the urinary system during pregnancy is the hormone progesterone. Okay, so the progesterone have played a crucial role in maintaining the healthy pregnancy and has notable effects also in the urinary system. First, progesterone causes dilations or widening of the ureters, okay, particularly the right side. This dilation allows for better drainage of urine from the kidneys to the bladder. However, it can also make pregnant women more susceptible for urinary tract infections. So there should be a close monitoring and appropriate care are essential. Okay, another one, progesterone will also relax the muscles of the bladder, leading to an increased urine capacity. The relaxed bladder tone allows the bladder to hold a larger volume of urine, reaching to approximately 1,500 milliliters. Okay? This increase in urine capacity will help accommodate the growing fetus and the reduced in the frequency, or it reduces the frequency of urination. Another effect of progesterone is the increase in aldosterone production. So this aldosterone is a hormone that will be regulating the sodium and water balance in the body. So during pregnancy, the increase in aldosterone level will lead to sodium and water retention, which can contribute to the generalized edema or swelling, or it is commonly observed in pregnant women on the dependent extremities or in the lower extremities. Lastly, many pregnant women will be experiencing urinary frequency during the night or known as nocturia. This occurs due to the combination of factors including the pressure of the growing uterus on the bladder, there is an increased fluid intake, and the changes in hormonal levels. So it's important for the expectant mothers to understand the normal physiologic changes causing nocturia and manage it by adjusting fluid intake patterns, especially in the evening. We will also be exploring the fascinating changes that are occurring in the gastrointestinal system. So one of the commonly experienced gastrointestinal changes during pregnancy is nausea and vomiting, or often referred to as morning sickness. Morning sickness is typically occurs during the first trimester and is considered a normal part of pregnancy. We can remember the acronym LEGS or LEGS to help us understand some factors that may contribute to this phenomenon. So the first factor is L for lowered maternal blood sugar. The developing fetus require a sufficient supply of glucose for growth and development. To meet the increased energy demands, the mother's body adjusts its metabolism, which can lead to lower blood sugar levels and thus resulting to nausea and vomiting. Second factor is E for estrogen and progesterone increased levels. This hormone plays a crucial role in the maintenance of pregnancy, but they can also affect the gastrointestinal system. The elevated hormone levels may disrupt the normal functioning of the digestive system, leading to symptoms of the morning sickness. Third factor is G for gastric motility decreased. During pregnancy, the muscles of the gastrointestinal tract relaxes due to the influence of the hormone, particularly the progesterone. This relaxation slows down the movement of food through the digestive system, potentially contributing to the feeling of nausea and vomiting. Lastly, the letter S for sensitivity to high levels of the human chorionic gonadotropin, which is a hormone that is produced during pregnancy, and it also play a role in morning sickness. So some women may be highly sensitive to HCG, leading to increased nausea and vomiting. To manage this morning sickness effectively, we can also remember the acronym CADE or the CADE. C stands for carbohydrate intake should increase. Consuming small frequent meals or snacks that are rich in complex carbohydrates can help stabilize blood sugar levels and alleviate the symptoms of this morning sickness. A stands for avoid fluids with meals. So drinking fluids separately from meals can prevent the stomach from becoming too full, reducing the likelihood of nausea and vomiting. D refers to dry crackers or bland snacks, especially by the bedside. So eating few dry crackers before getting out of bed in the morning can help settle the stomach and alleviate morning sickness. E advises eating a light breakfast or delaying breakfast until later in the morning at around 10 to 11 a.m. So this approach allows the body to adjust gradually and may help the feeling of nausea. Another common change in the gastrointestinal system is decrease in gastrointestinal motility and longer emptying time, which can lead to the discomfort called the constipation. So this occurs due to influence of the hormone, specifically the progesterone. So on the smooth muscles of the digestive tract, wherein there will be a slowed movement of food through the intestines that allows more time for water reabsorption, resulting to a firmer stools and difficulty passing them. So to effectively manage constipation during pregnancy, remember some of these key strategies. First is to increase fluid intake. Adequate hydration helps soften the stool and promote regular bowel movement. It is recommended to consume at least 8 to 10 glasses of water per day unless otherwise advised by a healthcare provider. Secondly, incorporating fiber-rich foods in the diet is also essential. So fiber adds bulks to the stool, making it easier to pass. Okay, so include foods like whole grains, legumes, vegetables, and fruits to the diet to increase fiber intake. Speaking of foods, certain fruits like papaya, pineapple, mango, watermelon, and apple with their skin can be particularly beneficial for relieving constipation. In addition to these dietary modifications, regular light exercise is highly recommended. So engaging in 30 minutes of walking or other gentle exercises daily can also stimulate the bowel movements and promote better gastrointestinal function. Another important change in the gastrointestinal during pregnancy is the pyrosis, or is commonly known as heartburn. Pyrosis occurs due to the relaxation of the cardiac sphincter or the muscle valve that separates the esophagus from the stomach. So this relaxation will allow the gastric content to flow back up into the lower esophagus, causing now the irritation to the delicate esophageal lining and resulting to a burning sensation. That is why kaya po siya tinatawag na heartburn. Hindi po siya sa puso ang may problema. This is because of the reflux or the um, backflow of content of the acidic content of the stomach. So to effectively manage this heartburn or this pyrosis, you have to remember the 4S. First is you have to opt for small frequent meals instead of the large ones. So consuming smaller portions will help reduce the pressure of the stomach, and thus it will minimize the likelihood of experiencing the reflux. Second will be when lying down, um, you have to advise the mother to elevate the upper body using two pillows or by adjusting the sleeping position. So this elevation can help prevent the backward or the backflow of gastric content into the esophagus. Third will be advise the mother to avoid spicy and fatty foods. These types of food po kasi are known to exacerbate heartburn symptoms, and it will increase further production of the stomach acid. So they have to be advised for a lighter or for more easily digestible meals instead. Lastly, sips of milk can provide temporary relief from burning sensations caused by heartburn. So milk has alkaline properties that can help neutralize the stomach acid and soothe the esophagus. Remember, sips of milk and not um, a full glass instead. Okay, so dapat sip lang. During pregnancy, the movement of bile from gallbladder slows down due to the influence of hormones and the relaxation of the smooth muscle. So this slower bile movement can also lead to the reabsorption of the bilirubin. So bilirubin, yun po yung yellow pigment formed from the breakdown of the red blood cells. Okay, so it will be reabsorbed into the maternal bloodstream. As a result, okay, women may experience generalized itching. Okay, so nangangati po sila or nagkakaroon po sila ng pruritus. This is due to the elevated level of bilirubin in their blood, um, in their circulation. So, management for this pruritus is to advise the mother to have cool bath. Okay, so taking cool baths can help them relieve the itching. Okay, and you also educate them or to instruct them, avoid scratching. Okay, so it will irritate their skin and they will make it more itchy. Okay, they can also use moisturizer, which will help reduce this itching. There are also over-the-counter medications such as the diphenhydramine or Benadryl or the hydroxyzine. Okay, but again, since pregnant women are a very vulnerable group, it is very important to advise them to consult their obstetrician before taking in any medication. Additionally to the slower movement of the bile and changes in its composition during pregnancy, the increase it will also increase the predisposition for gall gallstone formation. So gallstone, these are the solid depositions that form in the gallbladder and can cause pain and discomfort. So here are the some of the management for gallstone. So dietary modifications. Okay, so a healthy diet is also important for preventing gallstone. So this will include po yung they should eat plenty of fruits, vegetables, and whole grains. And of course, to avoid fatty foods and processed foods. Okay, it is also important to advise them to lose some weight. If they are obese or they are overweight, losing weight can help them reduce the risk for gallstone formation. Medications, there are also some medications that can help prevent gallstone. But again, it is very important to notify their physicians before taking in any medications. For surgery, if a woman will be having a gallstone that are already causing pain or other problems, they might need to undergo surgery to remove this gallstone. Next is the development of hemorrhoids. So hemorrhoids, these are the swollen veins located in the lower rectum or anus. They can occur due to the increased pressure exerted on the veins by the growing uterus and are often associated with constipation, which is a common gastrointestinal issue during pregnancy. To manage hemorrhoids, there are several strategies we can recommend to our clients. First is hot sitz bath. Okay, yung hot sitz bath, either is a, parang yung, yung sa isang timba, nilalagyan po yan ng warm water. Okay, tapos uupo yung si mother doon. Okay, and it will provide a relief by promoting blood flow and reducing swelling of the affected area. Okay, next is managing the constipation. So like what we have mentioned a while ago, it is crucial to prevent this managing constipation is crucial in prevention of the hemorrhoids. So we can achieve this by increasing fiber in the diet, drinking plenty of fluids, and engaging into a regular physical activities. Okay? It is also important to advise pregnant women to avoid the use of laxatives, okay, without medical supervisions. Instead, encourage them to adopt a well-balanced diet, including fruits, vegetables, and whole grains, which will naturally promote bowel regularity. Thialism is another gastrointestinal changes or during pregnancy. So this refers to the increase in production of the saliva during pregnancy. Okay, so while the exact cause is still unknown, hormonal changes are believed to play a role. So although thialism can be bothersome, okay, it is usually considered normal during pregnancy. So this type of disturbances during pregnancy po yung parang laging naglalaway ang isang buntis. Another one is the epulis or this refers to the hypertrophy or swelling of the gums. So it is thought to be related to hormonal changes and the increase in blood flow to the oral cavity. So good oral hygiene practices, including regular brushing and flossing, along with regular or a routine checkup, okay, are also essential in managing this epilis during pregnancy. Lastly, meron po tayong PICA, which is a condition that is characterized by a strong craving of non-food substances such as ice, dirt, clay, or even laundry detergent. So, pika, ito po yung paghahanap ng hindi mo naman talaga usual na kinakain. Okay, so these cravings may indicate underlying nutrient deficiencies such as iron or zinc. Okay, so it is important to address these cravings kasi these are not normal and ensure that their nutritional needs are being met through a balanced and varied diet. So if pica cravings persist or are concerning, it is advisable to seek medical evaluation and support. Next, we will also delve into the changes that occurs in the integumentary system during pregnancy. Okay, so let us explore the acronym A Girl Sits Poised to understand this adaptation. Okay, firstly, the appearance of the linea nigra. So as you can see in the image, nagkakaroon po siya ng dark line that forms vertically in the middle of the abdomen, extending from the pubic area to the umbilicus or even higher. Okay, so this is caused by increase in pigmentation in the skin. Typically, it will fade after childbirth. Next is that the integumentary system undergoes changes in sweat and subcutaneous gland activity. So there will be greater sweat and subcutaneous gland activity. So pregnant women or may experience increased perspiration and oiliness of the skin due to these hormonal fluctuations. So it is important to maintain good hygiene and skincare practices to maintain this or to manage these changes. Stray gravidarum is also common, okay, during pregnancy. Stray gravidarum is also known as the spider nevi or yung parang um, stretch mark rather. Okay, that they develop in different parts of the body, but it is more commonly observed in the abdomen, breast, buttocks, and thighs. Okay, so the reddish purple to purplish streak occurs as a result of the skin stretching to accommodate the growing fetus, while they may fade over time and they often become a permanent fissure. Okay. Next, the increase in pigmentation of the nipple and areola around the is another common change. So this area may darken and they may become pronounced during pregnancy. Okay. Lastly is the cloasma, or also known as the mask of pregnancy. So a condition that is characterized by the appearance of dark or irregular shaped patches on the face. So these patches are typically seen on the cheeks, forehead, or upper lip. Okay, sun exposure can even exacerbate this cloasma, so it is important to advise individuals to protect their skin from the sun's rays using sunscreen or appropriate clothing. Furthermore, the changes that occur in the skeletal system during pregnancy is also as important as the other system. First, there is a softening of ligaments and joints, particularly in the symphysis and the sacroiliac joints. So this is common during pregnancy, and is primarily caused by the hormones relaxin and estrogen. So the purpose of this softening is to prepare the pelvis for childbirth by allowing greater flexibility and mobility. However, this can also result in increased joint instability and potential discomfort to the mother. Another one is the leg cramp. Okay, so these cramps can be attributed to the pressure exerted by the gravid uterus on the nerves and imbalance of calcium in the body. So we have to advise our clients that adequate hydration and gentle stretching exercises, and of course, ensuring a balanced diet with sufficient calcium intake can also help alleviate leg cramps. During pregnancy, it is also noticeable that there is a change in posture known as lordosis, or this is often referred to as the increased curvature of the lumbar spine, leading to a more pronounced lower back portion. So, tinatawag po natin the pride of pregnancy. Okay, another one, there's also a relaxing effect of hormone on the joints. Okay, so nagkakaroon din po ng waddling gait in the pregnant women. So this is referred to as the awkward walking posture characterized by a wider um, stances and a rolling motion of the hips. So it is essential to advise pregnant women to wear low-heeled shoes which will provide better stability and reduce the risk for accidents. So as a midwife, it is our responsibility in relation to these skeletal changes during pregnancy to educate and or to counsel our clients. So we should provide them comprehensive education about the normal changes occurring on their skeletal system, including for the explanation of the softening of the joints and the ligaments, the purpose of the lordosis, and the potential effects of posture gaits. So if there are pain, we should also give them pain management. Okay, so this may involve recommending appropriate exercises and stretches to alleviate joint discomfort or referring the individual to therapy or to a physician. Okay, so it is also our responsibility to promote safety for our pregnant clients. So we must emphasize the importance of maintaining proper body mechanics and posture during daily activities to prevent nga po yung strain or injuries. Another one is the use of the correct footwear or assistive device. So we have to assist or instruct the woman to wear low-heeled shoes, which can provide them better support and stability during if they have this waddling gait. So specifically, this is common during the later parts of pregnancy. Another one is the collaborative care. So if there is already support, severe pain or instability, okay, we have to collaborate with other healthcare providers such as physical therapists or the obstetrician. So by addressing or this discomforts, a midwife have to support this pregnant woman by managing them properly. Okay, so there are also changes in the metabolic, okay, during pregnancy. So one significant metabolic change during pregnancy is the acceleration of the metabolic rate. So there is an increase by up to 20%. So this heightened metabolism is essential to meet the increased energy demand required by the growth and development of the fetus, as well as the occurring changes in the mother's body. So with the weight gain, this is a natural part of pregnancy and it varies in each individual. So on average, a pregnant individual can expect to gain a range or at around 25 to 35 pounds throughout the duration of pregnancy. So dapat yun na po yung maximum na weight gain or average weight gain throughout the duration of pregnancy. So let us take a closer look on the breakdown of this 25 to 35 pounds. So for the placenta, this should be approximately 1.5 pounds. The breast, which will be becoming full, okay, or will becoming enlarged. Okay, so that is 1.5 to 3 pounds. Amniotic fluid is 2 pounds. Uterus is 2.5. Blood volume increased 4 pounds. Body fluids rather will be 4 pounds, body fats is 7 pounds, the fetus will be approximately 7.5 pounds. Okay, so as a midwife, it is important for us to monitor and educate our pregnant clients about the normal weight gain pattern during pregnancy. So, ano po ba yung pattern dapat ng pag-gain lang? So, here is the breakdown of a typical weight gain recommendation throughout the pregnancy. So, during the first trimester, a weight gain of approximately 1 pound per month is considered as normal. Okay? Second trimester, weight gain tends to increase. So, nagkakaroon na po ng approximately 1 pound per week. Okay, so this is because of there is already a rapid fetal growth and there is already an increase in blood volume and the amniotic fluid during this time. So 1 pound per week. On the third trimester naman, with the average of 1 pound per week. So the final stage of pregnancy sees further growth of the baby, expansion of the uterus, and potential increase for the amniotic fluid. So it is important to note that these weight gain guidelines are general recommendations and individual variations are still common. So factors such as pre-pregnant weight, maternal health, and the possibility of having a multiple pregnancy will also influence the weight gain pattern. So, yung mga recommendations po na ito, this pattern of weight gain na nakapresent po in this slide is for general. Okay, yung buntis na isa lang yung kanyang growing fetus. Ganun. Okay, so it can still be affected by the pre-pregnant weight, okay, kung ano ba yung maternal health condition, and of course, the possibility of having a multiple pregnancy. So as a midwife, we should regularly monitor their weight every clinic visit. In conclusion, so the physiologic adaptations of the mother to pregnancy are a remarkable and necessary to support the growth and development of the fetus. So throughout the pregnancy, the mother's body undergoes numerous changes in various systems to accommodate the needs of both herself and the baby. As a midwife, it is crucial for us to understand and recognize these physiologic adaptations to provide comprehensive care and support to pregnant individuals. Our role involves monitoring and assessing these changes, educating expectant mothers about the normal courses of pregnancy, addressing concerns and discomfort, and of course, promoting healthy lifestyle practices. So by being knowledgeable about these adaptations, midwives can empower and guide pregnant individuals throughout their journey, ensuring the best possible outcome for both the mother and the baby. So by fostering a supportive and a compassionate environment, we can provide the necessary care to help women navigate these physiologic changes and of course to embrace the transformative experience of their pregnancy. Remember, our understanding of these adaptations will enhance our ability to provide holistic care and make a positive impact on the health and well-being of both the mother and the newborn. Thank you.